Hi group, Angela Springer here. I'm spontaneously going live today to talk about differential diagnosis with OCD, and I just want to quickly talk about the problem with generalized anxiety disorder versus obsessive compulsive disorder in differential diagnosis, because I think this is probably the hardest one to differentiate because they can look so similar, and a lot of therapists don't really know what they don't know about OCD, so may misdiagnose OCD as generalized anxiety, and the treatment is there's a different approach for it. So treatment could be harmful for somebody if you think that they have generalized anxiety, but what you're actually looking at is OCD. And I would love for other therapists that have experience with OCD to chime in here, because this is something that can be really challenging to figure out the difference with. So what are the similarities between GAD and OCD? Well, the similarities are that there can be unwanted, or there are unwanted thoughts present for both. There's often rumination present for both of them. It causes a lot of distress for both of them. It can interfere in people's lives for both of them. Differences are, now you think about OCD like a lot of times as having like less like common daily life worries around it. So a lot of times you might notice somebody with OCD that their worries are going to be less realistic than somebody with generalized anxiety disorder. However, I don't think that is always the case, and it is a dangerous thing to assume that because somebody's having a lot of unwanted thoughts about something that is like a common daily life worry, that it means it's generalized anxiety, because it doesn't. But that is one thing to take a look at. Are the thoughts like more unrealistic? Are they more realistic? Are they about real life concerns? That would be something that would, raise a little bit of a flag of maybe this is GAD, maybe it's not. And I think the other thing that is so tricky with OCD and really differentiating it is that OCD has compulsions that are involved in it. So sometimes it can be really obvious that there is a compulsion, hand washing, praying, seeking reassurance. And some of the compulsions, obviously it's a compulsion. You're counting, you're knocking, you're tapping. But as we understand more and more about mental compulsions, we start to realize that some of the things that maybe we thought were generalized anxiety disorder are actually manifestations of mental compulsions. And now research and therapists in the field are really starting to understand rumination as a mental compulsion, or it can be a mental compulsion. And this kind of throws a wrench into things with differential diagnosis, because rumination is often thought of something as more linked to generalized anxiety, but it really can be a compulsion. So there really isn't a perfect answer to the differential diagnosis, but I usually will tell people that if you suspect that it's OCD, then let's treat this like OCD, because the treatment will be more effective, and you're much more likely to cause harm if you are treating it as GAD when it really is OCD. So other people chime in. Let me know, what do you notice? What did I miss? What can help everybody understand, especially knowing in this group we do have a lot of therapists that are new to OCD treatment, and the biggest factor here is when you don't know what you don't know, you will misdiagnose and patients will not get better. So chime in, help us all understand, add some things in the comments, and we can continue this discussion on differential diagnosis of OCD versus GAD. All right, thanks guys.